In this video, we are going to show you how to prepare thin and thick smears for blood parasite exams. After the collection of blood into an EDTA tube, slides must be made within a 6-hour time frame. Timing is important because the parasite will continue its life cycle within the tube, presenting in morphologies laboratory technologists cannot identify, leading to false reporting. While making the blood smears, PPE includes a face mask, lab coat, and gloves. A biosafety hood is not required if you are wearing a face shield. Before making the smears, you will need glass slides, 2 double slide holders, the specimen and rack, a biohazard container, plastic transfer pipettes, and a biohazard transfer baggie. Both a thick and thin smear is required because the thick smear provides a larger volume of blood, increasing the chance to detect low-level parasitemia and other malaria forms, while the thin smear is useful in diagnosing what species of blood parasites are causing infection, as well as to calculate the percent parasitemia. To begin, label 4 slides with 2 patient identifiers. 2 slides will be made as thin smears and 2 will be made as thick smears. Invert the tube 3 to 4 times and with a plastic pipette, place a pea-sized drop of blood about 1/4 of an inch from the frosted end. Place the slide horizontal and take another slide as a spreader slide. Holding at a 45-degree angle, place it between the drop of blood and the non-frosted end of the slide without touching the blood. Pull the spreader slide back into the blood until it runs along the entire edge of the slide and push the spreader slide across to produce a thin smear. Again, looking closely, the spreader slide is placed at about 45 degrees, pulled back until the blood runs along the edge, and then pushed across the slide in a fluid motion. Moving on to the thick smears, start by placing a nickel-sized drop of well-mixed blood onto both slides. Take another clean slide and use the corner edge to spread out the blood in a circular motion. Again, looking closely, it is important to apply enough pressure so that you can actually hear the glass scratching. This helps keeping the blood from rinsing off during the staining process. Once finished, the blood smear should be slightly bigger than the size of a quarter. Once all 4 slides are made, set them aside to air dry. Once the slides are finished and completely air dried, place the 4 labeled slides into the slide holders and place the slide holders into a biohazardous bag along with the patient's EDTA tube. Seal the bag shut and place the patient's labels on the outside of the bag. The specimen is now done and ready to be sent out. If you are new to making blood smears, it may take some time to correctly make them. Here are some tips on how to fix your thin smears if you are running into one of these 3 problems. When your thick smear is complete, the blood should be transparent enough to see text behind the glass. It is helpful to put the slides onto a white background containing text to ensure this is correct. Both of these slides shown here are incorrect. Even though the slide on the left is transparent enough to see text through the smear, it is too large, as it should only be slightly larger than the size of a quarter. The slide on the right is too thick, and you cannot see text through it and must be spread out.